Hi, my name is Dr. Karita Anderson, and I'm the founder of the Boston Center for Couples and Sexuality in Arlington, Massachusetts. Today, I'd like to talk about a technique I use with my patients called Vergence. And it's something that I teach them, particularly when they're feeling incredibly anxious. It's a way for them to quickly calm their bodies down and be able to think again and be present. Very often we find ourselves becoming anxious when we don't understand why we might be becoming anxious, and that can be confusing and also very frustrating for people. So Vergence is a way to bring your physiological system back down from being highly reactive. So what often happens when you find yourself having a panic attack or anxiety that's less intense than that is that your sympathetic nervous system is kicking in, leading your heart rate to increase and your breathing to increase. It's getting you ready to either fight and protect yourself or to run away. And mostly it's to get ready to run away. So what Vergence does is to help your parasympathetic nervous system come online. And that's what calms everything down, what slows down your breathing. It slows down your heart rate and really allows you to be more present and calm. So normally as you go along your everyday life, you're folding laundry, you are making decisions about what to wear for the day, making decisions about what to cook for dinner, how to get to the grocery store, you're using this part of your brain, which is the frontal cortex and the neocortex. Your heart rate, your breathing, all your digestion, all those things, your reflexes are being controlled by this part of your brain. And this part of your brain and this part of your brain are not actually directly connected. So they're not actually communicating all that well to each other. So very often when this part of your brain responds and reacts and you feel tense, your muscles feel tense, your breathing gets faster, your chest might feel tight. You might feel like the room is closing in on you, or you feel like you want to escape and get out. This part of your brain might kick into action with a wide range of stimulation, right? So that might be taking a calculus test, or that might be getting ready for a lot of relatives coming over for dinner, or that might be getting ready to buy a new car or something like that. So when that happens, this part of your brain is trying to come up with a reason why you might be feeling upset or scared or tense. And it actually might not be what this part thinks. It might be that you're responding to some memory that you had, some experience you had when you were younger, and it can feel very much the same. Your body responds in the same way, whether it's your Aunt Marjorie coming over that you don't like very much and who always teases you and leaves you feeling really small, or it might be reacting the same way as when you have to do 20 push-ups in front of the whole class at school. So the technique that I'm going to show you, called Vergence, is a way of bringing your parasympathetic nervous system online. And that's the system that calms everything down and helps you to restore your breathing and helps your heartbeat to come down. And so lets you know that everything is actually okay. So I'm going to use this pointer. So this is a tool that I use in my office with my patients to do a therapeutic framework called brain spotting. And I have another video that talks more about that. Or you can go to www.brainspotting.com to learn more about that. So when you find yourself feeling reactive, meaning that you're feeling super anxious, your heart's racing, you're breathing rapidly, those kind of things, feeling kind of scared, you can pull out, it can be a pen or a pencil, anything with a point, okay? And so what we're going to do is hold it about 6 inches in front of your face. So about from here to here, okay? And you're going to look at the point. You're going to go from looking at the point to looking at the farthest point away that you can see. For me, it's the wall. So I'm going to look through here for about 5 seconds, and then I'm going to look through that to the farthest point for about 5 seconds. And then I'm going to come back to this point for 5 seconds. And I'm going to keep going back and forth, oscillating between the near point and the far point for about 5 minutes. So just to recap, find something with a point on the end of it, hold it about 6 inches in front of your face, focus on the tip for 5 seconds, then look through it to the farthest point away for 5 seconds, and then just go back and forth between the 2 points for about 5 minutes. And then you're most likely to notice that your breathing has calmed down, your heart rate is slowed down, and you're much more able to be present. You can do this anywhere. You can do this in a staff meeting when your boss is saying something that really kind of irritates you. Nobody has to know. You can just put your pen up like this, and you can just look down at the floor. And pretty soon you will feel your parasympathetic nervous system coming online so that you can get to a point where you are calm again, and you no longer have to be in a position where the people around you are really leaving you feeling angry and reactive and annoyed. And so Vergence is a strategy that anybody can use at any time. And even if you're having a hard time falling asleep sometimes, you can use Vergence to look at a point and then look up at the ceiling, for example, and oscillate between looking at the point in front of you. You can hold up your finger and look at the point of your finger, and look at your finger, then look at the ceiling, then look at your, look at your finger and look at your ceiling. You can do that. The parasympathetic nervous system is an amazing tool that we have, and we can actually harness that to bring ourselves to greater presence, so that we can be more effective in what we want to do. The point is to be able to choose your behaviors rather than being reactive. You always want to be able to bring your neurological system back down so that you can choose what you want to do and how you want to respond rather than simply reacting. So if you found this helpful, please feel free to look through and look at some of my other videos that I have, and feel free to shoot me a comment in the comment section, and I hope that you found it to be helpful. Again, my name is Dr. Carita Anderson. Have a great day.